Good evening, dear students. Hope you're doing good. Welcome back to Medicine Nursing. And in this today's sessions, we will discuss further regarding anatomy of female reproductive system. This is the part 2, and from part 2, we will discuss further internal genital organs of female. So let's begin this session. So in part 1 of video, which I already add in description, you can go and check it out, the part 1 of anatomy of female reproductive system, where we have discussed that whole anatomy of female reproductive tract are categorized into 3 parts, that is external genital tract, which we can see from outside, internal genital tract or organ, which is situated or located in the pelvic cavity and we can't see it from outside, and the accessory organs which is important for or help in the time of intercourse, and the example is breast. And in part 1 we have discussed regarding which all are organ coming in external genital organs, and that is mons pubis, labia majora, labia minora, clitoris, vestibule. We have discussed that vestibule is having total 6 opening. One is urethral opening, 2 paraurethral glands, 1 introitus, that is the entrance of vagina, and bulbourethral gland, which is 2 in number. In these today's sessions, we will discuss regarding the internal genital organs. Okay, so internal genital organ means the organ which, those organs which located in the pelvic cavity. So this is the part of the female reproductive system, and in this we will level that what all are organs coming under this internal genital organs, and those are coming to this first part, that is ovary. Ovary is 2 in number. These 2 are called ovary. Okay, situated in the pelvic cavity, coming under the internal genital organ. This is fallopian tube. So this fallopian tube also 2 in number. Here is one fallopian tube and here is another fallopian tube situated in the pelvic cavity, coming under your internal genital organs. Then your uterus. Uterus, this is the part of your uterus. This is also internal genital organs. Then this is called internal os. This is called, this small one, it is called external os. Surrounding this external os, there is exocervix. So where is endocervix? In this region. It is called your endocervix. So cervix is divided into exocervix and endocervix, and in this whole portion it is called cervix. And where is your vagina? This part is called vagina. So those all are coming under your internal genital organs. Okay, so what all are those organs? Ovary, fallopian tube, uterus, cervix, vagina, those are coming under your internal genital organs. So in these today's sessions we will discuss only the ovary, that is one of the internal genital organs, and in the upcoming sessions we will discuss one by one fallopian tube, uterus, because we need to explain one by one what is endocervix, what is exocervix, what all are functions of those parts. So video will be lengthy, that's why I have discussed here only the ovary portion. So let's begin. Ovary, that means female gonads. Female gonads, from where ovum is formed, that is important for making a baby. So ovary, these 2 are ovary and 2 in number. Okay, so location, first we will discuss the location of the ovary. So where it is situated or located, it is present on each side of your uterus. So here you can see this is the uterus, and both side, in this side, both side one ovary is situated. So present on each side of uterus in ovarian fossa. Okay, so that's what you need to remember regarding the locations of the ovary. And it is attached through various ligaments that we will discuss further. So location is each side of the uterus in ovarian fossa your ovary is located. Okay, now coming to the shape. What is the shape of this ovary? The shape of this ovary is, we can say it is almond shape. Okay, or we can say it is ovoid shape. Okay, this is the shape of this ovary. Coming to the size of this ovary during the reproductive age of a female, the size is 3 centimeter, 2 centimeter and 1 centimeter. 3 centimeter is in length, 2 centimeter is in breadth and 1 centimeter is in thickness. Okay, so this is the size of the ovary. Now coming to the weight. During reproductive age, the weight of this ovary is 5 to 10 grams. Each ovary is 5 to 10 grams. And you remember this color also. The color of a healthy ovary is purely white. Okay, purely white in color. Okay, so that's all about the shape, size and weight of this ovary. So shape is almond or ovoid shape. Size is 3 centimeter, 2 centimeter, 1 centimeter. Weight is 5 to 10 grams each ovary, and the color is purely white or purely white in color. Now coming to the parts. So you can see this is the ovary, right? So if you elaborate or if you make it broad, your ovary will be like this. Somewhat it is like this, right? So if we discuss about the part of this ovary, you can see here this outer portion, it is like your outer cortex, and the inner portions we will say it is inner medulla. So this is the two part of this your ovary. So what all are present in outer cortex? In outer cortex region, ovarian follicles. So there are different kind of follicles, like your primary follicles, okay, secondary follicles, then tertiary follicles, various follicles, mature follicles. One by one it is get matured throughout your menstruation phase, right? So all ovarian follicles are present in this outer cortex. So you can make a note like this: in outer cortex contains ovarian follicles. Okay, at different stages of development. So first primary follicle, then coming to your secondary follicle, then mature follicle. From this mature follicle, secondary oocyte will come out, then it will become corpus luteum. Like this different phases are there na? So all follicles are situated in the outer cortex, and in this outer cortex this is covered by your germinal epithelium. Okay, so your ovaries outer cortex is covered by your germinal epithelium. You can also write it here, covered by germinal epithelium. Now coming to your inner medulla. So inside this medulla or inner medulla, what all are present? Here these various nerves are present. Okay, nerve ending, then your blood vessels are present. Okay, then lymph nodes, everything, lymphatic tissue, connective tissue, all are present. So inside this medulla or inner medulla contains blood vessels, then your lymphatics, nerves, etc. Okay, now coming to the functions. So what all are functions are there in case of ovary? So ovary's function is to secrete ova. Actually it produces ova. Okay, so you know this one immature follicle or primary follicle gets mature into primary follicle, then secondary follicle, etc. Then this follicle contains secondary oocyte. Okay, secondary oocyte. So when this secondary oocyte gets rupture, okay, the secondary oocyte is get rupture, it will become corpus luteum, right? This corpus luteum secretes progesterone, and those follicle secretes your estrogen. So if you say what is the functions of ovary, one exocrine function is, this is the exocrine function, that it produces ova. And the endocrine functions, if you say, the endocrine functions of ovary is to secrete your estrogen and progesterone. Estrogen secreted by your follicles, and your progesterone secreted by your corpus luteum, okay, corpus luteum. Now coming to your ligaments. So if I draw this uterus along with this ovary, so you can see this is frimby portions, and here is your ovary situated, right? So this is your ovary, fallopian tube, and this is your uterus. Okay. Now ovary is having various kinds of ligaments. First of all, there is ovarian ligament. This is the ovarian ligament. This ovarian ligament connects ovary with the uterus. So your first ligament is your ovarian ligaments. It connects ovary with uterus. Okay? Now coming to your second ligament, that is your, if we say this is the pelvic floor, lateral pelvic wall, okay, so from this side also ovary needs supports. So here with this pelvic wall, ovary is connected with the lateral pelvic wall through the suspensory ligament, or you can say infundibular ligament. So suspensory or infundibular pelvic ligament. So it connects ovary with your lateral pelvic wall. Now your third ligament. Third ligament is, you can say, broad ligament. So where is your broad ligament situated? See here in this full portion, the back, from this back side, your broad ligament is situated, and the front portions of this broad ligament is called your mesovarium. Okay, mesovarium, the part of the broad ligament just anterior to ovary, and that is the part of the broad ligament, also gives supports to the ovary. So what all are ligaments are present? One is your broad ligament, ovarian ligament. Second is your suspensory ligament or infundibulum, and third is your mesovarium, or your part of broad ligament that is situated anterior to your ovary, that also giving a support to the ovary. Now coming to the clinical relevance. So you heard about the females are suffering with your one case, if I discuss here, like your ovarian cyst. Okay, see here it is one kind of this sac, water, fluid filled sac. Where it is situated? Sac in ovary. It is cyst like structure. Okay, cyst like structure within the surface of the ovary. It is called ovarian cyst. What happen if a female suffering with ovarian cyst? Then there will be, it is actually asymptomatic in nature. okay, asymptomatic, but sometimes it can cause symptomatic symptoms like your pelvic pain. Okay, pelvic pain will be there, and the pain will be like very sharp in nature. Pelvic pain will be there, female will be having this blotting sensation, okay, and then irregular menstruation, irregular periods will be there. So those will be there in case of ovarian cyst, and it can also get ruptured. This ovarian cyst, if the size is bigger, then it will get ruptured, and if there is rupture, there will be hemorrhage. So this will be the complication of this ovarian cyst. And how will you diagnose? The diagnostic management will be your USG. Through this USG you can check this whether the female is having ovarian cyst or not, and what is the management or treatment protocol. Treatment will be hormonal therapy, because of sometimes due to your hormonal disbalance also this ovarian cyst will be there, and if the size is bigger, then your surgical removal, surgical management also you can go for this surgical management. Now coming to your second cases, you heard about this PCOS, polycystic ovarian syndrome. This prevalence of PCOS is in India is very common nowadays. Okay, it is also one kind of hormonal disorder. For this also multiple cyst will be there in this female ovary. So here also this symptoms will be like irregular periods, okay, and every month female are going through this menstruation. But in case of PCOS female, there will be irregular periods like 2 months, 3 months interval. This period will be there, acne will be there, okay, hirsutism will be there, mustache will form, okay. And then your weight gain, if a female will gain a lot of weight, okay, then infertility also can be there. Female will be suffering with for getting pregnancy, okay. Then what all are complications will be there if a female will be having PCOS? There will be, if the female is getting weight gain is there, then insulin resistance can be there, okay. Insulin resistance leads to your type 2 diabetes mellitus. Then infertility, as I said, everything can be there, okay. So what all are management? You have to do your lifestyle modifications. What all are lifestyle modifications? Regular exercise, avoid junk food, okay. Then walking, evening walk, morning walk, etc. For cycle regulation, menstrual cycle regulations, you need to take this OCPs, oral contraceptive pills, okay. And then if there is type 2 diabetes mellitus, then medical management will be, you can take this metformin and all. For infertilities management, you need to take this clomiphene citrate, okay, or letrozole, etc. are the treatment of this infertility cases, okay. And you can also heard about another cases like your ovarian cancer, okay, and this is very lethal in nature. Ovarian cancer, okay, very dangerous. And this ovarian cancer is malignant in nature, and symptoms will be like, if it is ovarian cancer, then bloating will be there, early satiety will be there, dizziness, okay. Then pelvic pain, patients will the female will be suffering with tiredness and all. Then urinary urgency will be there, okay. Then what all are risk factor like age? If a female will be having a previous cancer like breast cancer and all, then if is risk factor, like if it is a case of nulliparity, okay. Nulliparity means she never gave birth to any baby. Then early menarche, early menstruation, the first menstrual event in a female body is called menarche. And if a female will be having precocious puberty or having early menarche, first menstruations occur before it used to be happen. Then the late menopause, okay. Late menopause means the last menstruation of this female, and if it is happened lately, then also can be a risk factor. Then age also can be a risk factor, everything. So the management will be surgical removal of ovary, then your chemotherapy, etc. So what we have discussed in today's sessions regarding the internal genital organ. In internal genital organs, we have discussed only the ovary. In this next session, that means in part 2, we will be discussed regarding fallopian tubes and further. So in these today's sessions, we discuss regarding this internal genital organs parts, that is uterus, fallopian tubes, ovary, cervix, vagina, and ovary we have discussed further regarding the locations where it is situated, each side of the uterus in ovarian fossa, then the shape, size and weight of this ovary, the parts like outer cortex and inner medulla, what all are contents in those parts, functions of the ovary like secretes or produces ova and secretes hormones like estrogen, progesterone, supports ligaments, which all are ligaments supports the ovary like ovarian ligaments, suspensory ligaments and your broad ligament, that is mesovarium, the clinical relevance, okay, the ovarian cyst, PCOS, ovarian cancer, those can be happen in case of any hormonal disbalance or something abnormalities will be there in ovary. So that's all for today's sessions. In this next sessions, we will discuss further the female internal reproductive system. So